The most important warning sign that every clinician should watch out for with suicide is that suicide cannot be predicted, and that strikes people as odd. What I mean by that is all people who have mental disorder should be asked about suicide, and you should not assume that a person is not at high risk of suicide.
When patients have depression, we have to ask them about suicidal thoughts. Just like if we're treating somebody with a heart condition, we always ask about chest pain. The people who are most risk for suicide will be people who have had recent attempts at suicide. There'll be people who aren't sleeping very well, they're agitated. Alcohol and substance abuse will affect your judgment to make you more likely to commit suicide. People are more likely to commit suicide if they've had family members commit suicide. So we have to consider all these various risk factors out there.
Aside from being an older male, the greatest risk factors for completed suicide are having a psychiatric diagnosis, especially depression, bipolar disorder, schizophrenia, PTSD, having a substance abuse disorder or dependence, an eating disorder. A history of physical, sexual, or emotional abuse is an important risk factor. The recent loss of a loved one, financial stress, a serious medical illness, and access to lethal means, whether it's guns or drugs for overdose. The most worrisome experiences I have in my practice are with patients who have almost a sense of relief. Suicide becomes not only for them a way of escaping their emotional pain, but also a way to protect their family and help their family to escape from the burden that that individual in their mind is causing.